My name is Josh Kruger. I'm an ophthalmologist at Hadassah Medical Center who specializes in the field of neuro-ophthalmology. This is an introduction for medical students to the field of neuro-ophthalmology. I hope that it will be helpful. So in some ways, we can think about our assessment of a patient for a neuro-ophthalmic disorder as thinking about structure and function. Structure being more the ophthalmology and the function perhaps being more the neurology. What do I mean by that? Well, when a patient comes to see an ophthalmologist, we're able to put the patient in front of a slit lamp and basically assess all parts of the eye. We can see almost all the anatomy. So without even sometimes listening very much to what the patient's complaining about, the ophthalmologist will go ahead and look at the various parts of the eye, from the lids all at the most anterior part, all the way to the optic nerve, posteriorly, and even the orbit, and consider whether the anatomy looks normal or not. And a great number of diseases can simply be diagnosed based on anatomical inspection. When it comes to function, however, neurologists are much more used to testing for function because they can't see the brain. They therefore have to go ahead and test the ability of the brain to control the various parts of the body and make inferences from how the functional tests work regarding what the state of the brain is. And if we're testing function in terms of ophthalmology, we would be thinking about testing the cranial nerves, and certainly testing the cranial nerves is a very important part of our assessment. Some of the cranial nerves I've listed here might strike you as being somewhat surprising in terms of their connection to ophthalmology. Those that I've included were the 5th, the 7th, and the 8th cranial nerve, but they certainly do play a role in ophthalmology. It's beyond the scope of our assessment today, and we'll focus more on the 4 cranial nerves that are more intimately involved with the eyes, those being the optic nerve, the 2nd cranial nerve, and the oculomotor, trochlear, and abducens nerves, which control the eye movements. And of course, it's important to remember that when we're assessing function, what I'm showing you here is just the lower motor neurons that are involved in ophthalmology, and that there's very important considerations that need to be made about the contributions of the upper motor neurons in this assessment as well. And again, that is beyond the scope of the lecture. So we'll just focus, for example, on the 2nd cranial nerve. So here's a typical situation. A patient comes to see their ophthalmologist and says that there's something wrong with my vision. The ophthalmologist goes ahead and measures their vision and tells the patient, everything's fine. You're seeing perfectly well, 6/6 in both eyes, or 20/20 in the American system. You've nothing to worry about. And yet, the patient certainly does have a problem. And just checking the visual acuity missed the problem. So what wasn't checked here that needed to be considered as well? The answer would be things such as checking the peripheral vision, the color vision, and the contrast vision, and looking carefully to see whether the patient has a relative afferent pupillary defect. It's these abnormalities here that make one think about an optic neuropathy. When the patient simply comes in and has poor vision, we have no idea whether the reason for the poor vision is related to a cataract, a problem with their retina, an opacity in their cornea. But when we see these additional features, specific problems with their peripheral vision, color vision loss, contrast vision loss, and certainly a relative afferent pupillary defect, it directs us to think that the problem is much more likely with the optic nerve. We'll continue in the next lecture, or the next segment of the lecture, to talk about how we perform the visual field assessments.